Egyptian mummies provide fascinating insights into the prevalence of diseases, including rheumatic conditions in ancient populations. Studies using advanced diagnostic techniques such as X-rays, CT scans, and DNA analysis on mummified remains have revealed evidence of various rheumatic diseases in ancient Egyptians. 1. Osteoarthritis. Findings. Osteoarthritis, characterized by the degeneration of joint cartilage, is one of the most frequently observed conditions in mummies. Degenerative changes in the spine, knees, and hands have been found in numerous mummified remains, suggesting a high prevalence of this condition. Factors. The ancient Egyptian lifestyle, which often involved heavy manual labor, could have contributed to this. Farmers and builders, for example, were at high risk due to repetitive motion and heavy loads. Hammer 2. Diffuse idiopathic skeletal hyperostosis, DISH. Findings. Some mummies show signs of DISH, a condition that leads to calcification along the sides of the vertebrae, resulting in decreased spine flexibility. This disorder is often associated with metabolic conditions like diabetes and obesity, suggesting that the ancient Egyptians may have had similar health concerns. Evidence. Several high-status individuals, such as pharaohs, have shown signs of DISH, indicating that these conditions could affect both the elite and working classes. Number 3. Rheumatoid arthritis, RA. Evidence of RA in mummies is sparse, but some studies have suggested the presence of inflammatory joint diseases. RA is an autoimmune disorder that attacks joint tissue, but its clear identification in ancient populations has been challenging due to the absence of soft tissues. 4. Ankylosing spondylitis, AS. Findings. There is limited but significant evidence of ankylosing spondylitis, a condition where the spine and sacroiliac joints become inflamed, causing fusion. Skeletal analysis of some mummies has shown characteristic signs of AS, particularly spinal fusion. Cultural influence. The presence of AS suggests that genetic factors or environmental influences, like diet or lifestyle, might have played a role in its prevalence. Tar 5. Gout. Findings. Gout, which results from the buildup of uric acid crystals in joints, causing inflammation and severe pain, has also been identified. Evidence of gout in some elite mummies suggests that the diet of the wealthy rich in protein and alcohol may have contributed to this condition. 6. Possible causes of rheumatic diseases. Genetic factors. Some evidence points to genetic predispositions to these diseases. Environmental conditions. Ancient Egyptians faced environmental factors such as repetitive manual labor and potentially inadequate nutrition, which could have contributed to joint degeneration. Diet and lifestyle. The diet, particularly among the wealthy, could have exacerbated conditions like gout and osteoarthritis. 7. Diagnostic techniques. Imaging. X-rays and CT scans are crucial for detecting skeletal changes associated with these diseases. DNA analysis. Ongoing studies in paleogenetics aim to uncover the genetic predispositions of ancient Egyptians to rheumatic diseases. Histology. Microscopic examination of tissue remnants can provide clues about inflammation and joint damage. Conclusion. The study of Egyptian mummies offers valuable insights into the historical presence of rheumatic diseases, with osteoarthritis, DISH, and gout being among the most frequently identified conditions. While evidence for autoimmune diseases like rheumatoid arthritis and ankylosing spondylitis is more limited, the findings underscore the role of genetics, lifestyle, and environmental factors in the health of ancient populations. This review demonstrates how mummified remains serve as a time capsule, offering crucial knowledge about the long history of rheumatic diseases. Several famous and lesser-known Egyptian mummies have been examined for evidence of rheumatic diseases using advanced techniques. Here are a few examples where specific conditions were identified. 1. Ramses II, 1279 to 1213 BCE. Condition: osteoarthritis and diffuse idiopathic skeletal hyperostosis, DISH. Evidence: Ramses II, one of Egypt's most powerful pharaohs, lived well into his 90s. CT scans of his mummy revealed that he suffered from severe osteoarthritis, particularly in his spine and hands. Signs of DISH were also found, with calcifications along the vertebrae, limiting his mobility in his later years. Significance: the combination of these conditions indicates that even the elite, with access to the best care, could not escape age-related rheumatic diseases. 2. Merneptah, 1213 to 1203 BCE. Condition: arthritis, likely osteoarthritis. Evidence: Merneptah, the 13th son of Ramses II, also showed significant signs of arthritis. His spine exhibited degenerative changes typical of osteoarthritis, with evidence of wear in the vertebrae and other major joints. Significance: the condition likely caused chronic pain and limited mobility in his later years, similar to his father, Ramses II. 3. Amenhotep III, 1386 to 1349 BCE. Condition: osteoarthritis. Evidence: Amenhotep III, one of the great pharaohs of the 18th dynasty, was found to have severe osteoarthritis in the knee and spine. His skeletal remains also indicated dental problems, possibly exacerbating his health issues. Significance: this condition would have made walking painful and challenging, especially in his later years. The high prevalence of osteoarthritis in elite mummies like his suggests that age-related joint degeneration was common. 4. The Unknown Woman D, Screaming Mummy. Condition: osteoarthritis and possible rheumatoid arthritis. Evidence: this mysterious mummy, thought to belong to a royal family, showed signs of joint degeneration, particularly in the hands and knees. There is some speculation that this individual might have had rheumatoid arthritis or another inflammatory joint disease based on joint deformities. Significance: the combination of conditions could indicate the presence of an autoimmune disease or simply advanced osteoarthritis. 5. Lady Rye, 1570-1530 BCE. Condition: osteoarthritis. Evidence: Lady Rye, a royal nursemaid of Queen Amos Nefertari, showed significant degenerative changes in her joints, particularly in the spine. Her well-preserved mummy provides evidence of age-related wear and tear, likely from her duties as a servant, which may have included repetitive physical tasks. Significance: Lady Rye's case is an example of how osteoarthritis also affected individuals who were not part of the royal family, but lived closely with them. Number 6. The Mummies of Deir el-Medina. Condition: ankylosing spondylitis. Evidence: the workers who built the tombs in Deir el-Medina, a village near the Valley of the Kings, were found to suffer from ankylosing spondylitis, a disease that leads to the fusion of the spine. The remains of these workers show signs of spinal fusion and inflammation, consistent with AS. Significance: this condition is particularly interesting because it suggests that manual labor and physical strain may have contributed to a higher prevalence of inflammatory joint diseases among working-class Egyptians. Conclusion: the discovery of rheumatic diseases in these mummies not only sheds light on the health conditions of ancient Egyptians, but also reveals the prevalence of age-related and inflammatory diseases across different social classes. Advanced imaging and diagnostic methods continue to provide valuable insights into the lives and ailments of these ancient people.